Understanding Autism Meltdowns. Information gathered and interpreted by Enabling Autism. Disclaimer. This information are not of ours and we are not claiming as ours. We read through many articles from credible sources and extracted what we think is important for parents to know. Our opinions should not be taken as professional advice nor treatments. Always consult with your child's behavioral therapist, specialist or doctors for advice. We simply gathered in the information for parents and provide a readout of the information. Before we start, please support our effort in gather information to parents and creating learning contents for autistic children. Simply subscribe our channel and like our Facebook page. Thank you so much. Let us get started. Understanding Autism Meltdowns. What is an autism meltdown? Meltdowns and tantrums present with similar characteristics and qualities, therefore, at times they are being used interchangeably. The root causes of tantrums and meltdowns are very different, and it is crucial to manage them accordingly. This is very important for parents and caregivers to understand the differences, so we deploy appropriate techniques to manage the situation. Tantrum is often a goal-oriented behavior. Tantrums often occur in younger children, and as the child becomes older, they occur less frequently. Children who have temper tantrums are commonly conscious of and in control of their behavior, and they can modify the severity of their tantrum in response to a parent's or other caregiver's reaction. Children discover that throwing fits can get them a reward, such as a desired action or object. Children usually ask for something, and when their request is denied, they discover that they can get what they want by upsetting their parents or caregivers by acting out. When the child succeeds in reaching the objective, the disruptive behavior immediately stops because there is no longer a need for it. This article focuses more on autistic meltdowns as they are not age-related or a voluntary behavior in autistic children. Autistic meltdowns are a sign of distress and are not created as a reward request system. A meltdown is often caused by sensory overstimulation, overload. Many children with autism are too sensitive to different stimuli, including sounds, odors, lighting, etc. The person may become overwhelmed as a result of their oversensitivity and experience a meltdown. When compared to tantrums, meltdowns are frequently more intense, emotional, protracted, and challenging to manage. Children with autism respond in this setting by fighting back. They are utterly out of control, have no control over their actions, and struggle mightily to calm themselves. Meltdown can involve aggression as tantrum that may include kicking, striking, throwing items, punching, and biting because of the intense level of anxiety their body is experiencing. Meltdowns are very physically tiring and emotionally draining for the individual. This is due to the person having experienced a stressful circumstance and having a very emotional and adrenalized reaction. How to prevent meltdowns? For parents, dealing with autism meltdowns can be exhausting. It may be more effective to prevent them than to try and address them. In many cases, we can prevent meltdowns by communicate clearly with the child and use the knowledge we have about the child to avoid common triggers. Establish daily routines and try to generalize the events instead of specific items for flexibility. Your child should be informed about and prepared for any routine adjustments. For example, 10 a.m. to 10:30 a.m. physical exercise or PE. We can then define what is physical exercise to include walking, riding bike, and run on treadmill. That way, the child isn't just looking to ride the bike and might not be able to transition to run on treadmill on raining days peacefully. The key is communication. If we sit down with the child and tell them that it's raining outside, we can't bike outside because we would get wet. Should we run on treadmill or do jumping jacks? We give the child the controlled choices. We would be okay with either choice. Do not ask the child too broad of questions such as, "What would you like to do?" Have watchful eyes to check physical, emotional discomfort. Be sure the child is well and comfortable. Include water intakes as well as snacks plan in the daily routines. Additionally, incorporate bathroom breaks as autistic children often hold, and it can be very uncomfortable and might lead to accidents. Check the child's well-being by asking if they are okay, any discomfort or pain. Spots early signs of meltdowns and intervene in time. This step allows parents to resolve any physical, emotional discomfort early and reduce the buildups that lead to meltdowns. Recognize signs that your child is getting frustrated, angry, or anxious. Check whether there's anything you can change in the environment to help your child feel more comfortable. Prepare sensory toolkit. A sensory kit or a calm down kit is a customized set of objects, toys, calming devices, sensory items, that help prevent or de-escalate a child's meltdown. If your child chooses to use these things, they can frequently help them calm down. Be aware that this kit is ideal for preventing a meltdown. However, don't impose them on them when they're having a meltdown. Suggested items for sensory toolkit is at the end. Develop, practice coping strategies. When our kids are calm and receptive, we can work on emotional regulation together, taking deep breaths, counting backwards, or simply retreat to predetermined safe place. Encourage your child to practice their coping strategies daily. This will make it easier for your child to remember and use the strategies when they feel stressed or overwhelmed. When early signs of a meltdown are detected, remind your child to use their relaxation techniques or sensory aids from Toolkit. However, during a meltdown, there isn't much we can do to try to teach them coping mechanisms. Establish safe space and keywords. Think ahead and establish safe space for the child to retreat should there be a need. Establish keywords so you can properly respond. It can be as simple as a hug, inside your large coat, or putting sunglasses, mask, headphone on. Again, communication and your awareness of the environment as well as your child's reactions. Be supportive and acknowledge your child's emotions. Diffuse, redirect the attention with sensory toolkit. You can also slowly introduce and familiarize the child to undesired sensory inputs. Just small exposure at a time to build up tolerance. Please take very small steps while doing this. Take notes from previous meltdowns and refine your approach as necessary. Strategies to handle meltdowns. Sometimes an autistic meltdown is presented as just yelling and screaming. But sometimes they might involve self-injury and self-harm as well as biting and kicking. If the child is physically large, meltdowns become frightening and even dangerous. As the child doesn't have any control over their meltdown, it is often not possible to stop and control a meltdown in the process. In many cases, the meltdown lasts until all of the stored energy from the sensory overstimulation has been expended. However, there are other things that must be done in order to support a child experiencing an autistic meltdown. Since every child with ASD is unique, there is no one-size-fits-all approach to managing meltdowns. Not every meltdown management technique will always be effective with autistic children. However, there are some general strategies that can be altered to fit the character and conduct of your child. 1. Ensure safety for your child and yourself. The most important point in helping a child in an autistic meltdown is to ensure their safety. Due to the magnitude of the sensory overload, there is always a possibility for the child to get hurt while having a meltdown. As a result, we must work to keep children safe and protected. It can be vital to take the children somewhere calm to make them feel comfortable after removing them from the situation. Try to hold them if there is a possibility of them hitting their head or injuring themselves. Get them to a place where they feel safe. It is often the most effective way to deal with a meltdown. Get them to a corner or to the car, can be a good option when you are out. Children frequently inflict unintentional harm on others when experiencing a meltdown. It is extremely possible for children to hurt their parents or other caregivers who are attempting to help them, especially as they get older. In case the child reaches out, keep your distance. Therefore, be cautious to avoid injury while assisting them. It frequently takes more than one person to relocate a physically huge child to a calm, quiet environment without injuring them. 2. Stay calm and be empathetic. While maintaining composure during a meltdown is harder said than done, it is necessary. Our anxiety and stress can exacerbate the issue and lengthen the meltdown's intensity. We have a better chance of being able to safeguard them and ensure their safety during the meltdown if we maintain our composure. Be empathy and let your child know that you understand how they feel or what they are experiencing. Leave the room or location to help your child calm down. When we empathize with our kids and validate their experience, they feel heard. 3. Don't talk nor reason during a meltdown. Either the child experiences a full shutdown and inburst during the meltdown, or they suffer an emotional outpouring manifesting as wrath and fury. In all situations, they frequently lost the ability to speak, listen, or pay attention during the meltdown. Instead of attempting to verbally explain, we take actions like reducing sensory inputs, leaving the area, or engaging in tried-and-true distraction techniques. Therefore, there is no purpose in trying to calm them down by talking to them or trying to explain things to them. 4. Eliminate discipline during a meltdown. As we discussed before, autistic children can't control their meltdowns, so they shouldn't be punished for them. While they are experiencing a meltdown, it is therefore not a good time to try to teach them or remind them of anything. It can be very difficult for parents, but in this situation, it is important that you as a parent remember that the child is experiencing immense anxiety and is often scared. So, our anger and rigidity can only worsen their anxiety. Instead, after getting to safe space, let them have the freedom to cry loudly with a parent there. That action is to let them know they are supported. 5. Not to worry about staring bystanders if in public spaces. Meltdowns can feel embarrassing at times to parents when in public places and everyone is staring. We feel the judgment from people thinking that we are failing at parenting. Please don't. Remember that the person who is struggling and needs your support the most is your child. So direct all your attention into mitigating the meltdown at hand. Meltdowns at school, daycare. There may be various causes in a school or daycare setting. When they are with a parent or caregiver, they might be able to recover from a meltdown, but it might not be the same. When your child has a meltdown, the teacher will take on your role. You must consult with the teacher and come to an agreement on coping mechanisms in the event that your child has a meltdown. Share as much as you can so the instructor is aware of all of your child's triggers and how your child reacts to various strategies. Some additional strategies for helping cope with school, daycare meltdowns are: coordinate with school, daycare personnel to create a meltdown strategy for your child. Pack a meltdown kit in their bag. Request for a safe space to calm down. Work with teacher to get the weekly schedule and talk to your child of the activities ahead of time. Bedtime meltdowns. A child with autism may have a meltdown just before the day is done if they have been overstimulated all day. Some techniques for avoiding meltdowns before bedtime include: provide a calm bedroom to encourage sleep. Play gentle background music with binaural beats, link below. Avoid sugar food, drink before bedtime. Establish a bedtime routine. Use timer to count down to bedtime, 15 minutes, 10 minutes, 5 minutes. Use sleep aids like weighted stuffed toys, blankets, or special LED lamps. Avoid activities that your child finds hard to stop, screen time. These techniques may not always work, but they may set the stage for a successful and meltdown-free night for your child. Meltdown medication. While the majority of meltdowns can be controlled without medication, some aggressive or violent meltdowns may call for additional support. When thinking about medications for your child, consult their doctor. It has been discovered that some antipsychotic drugs, like Risperdal, risperidone, and Abilify, aripiprazole, are useful in treating irritability and aggression in autistic children. The FDA has given its approval to both of these drugs. Children as young as 5 years old can receive Risperdal, while those aged 6 and older can receive Abilify. The use of CBD oil for autism has been effective for other parents. Conclusion. Spending some time and engaging in some structured activities that can teach kids how to regulate their emotions and calm down is really beneficial. But before we can teach kids how to calm down, we need to make sure they can identify their emotions, understand how each one is felt and triggered, and know which emotions are bad or too strong and could lead to meltdowns or improper actions. Sensory Toolkit suggested items. Visual, auditory support. Noise-canceling headphones. Music player. Sunglasses. Hand sensory support. Fidgets. Stress balls. Squishy toy. Favorite stuffed animals. Rolled up paper tissue. Oral sensory support. Chewing gums. Lollipop. Visual, brain support. Booklet, cards for steps to calm down. Coloring books or puzzle games. Comfort support. Security blanket. Mask to cover face. Weighted blanket.